British Columbia is a vast land with large mountain ranges, wide open spaces, severe weather conditions, and many sparsely populated communities with an aging population. These are some of the challenges facing our BC healthcare system and those who provide healthcare. Imagine equitable access to healthcare services, no matter where you live, and opportunities for healthcare providers to access each other, and education that would otherwise not be available to them. The Vancouver Island Health Authority, with the support of various high-tech companies, has developed and implemented a telehealth program that aims to meet these challenges.
Telehealth for rural and remote is an incredible advantage to our healthcare professionals and also to our public.
It's so convenient, and it's the sensation is the same as sitting in the surgeon's office.
Telehealth is a wonderful idea because it allows you to go to your local hospital rather than traveling.
Well, it was very convenient. Instead of having to drive to Victoria, I just went down to the hospital and talked to my doctor.
The biggest benefit for staff in those remote communities is that they have access to our expert opinion for cases that they are dealing with in those remote communities.
Many people who live in rural and remote communities don't have access to the healthcare services. They may not have a car. They may not have a family who are living in Victoria. So it's a real hardship for them to have to travel down to Victoria or to a larger community like Nanaimo to see a consultant or have some type of healthcare services. So the more we can put telehealth into those communities, the better it is for healthcare access for them.
Our goal is that telehealth becomes integrated into mainstream care delivery. One day, telehealth is going to be such commonplace as meeting a coworker or your care provider face-to-face.
Telehealth connects people through easy-to-use technologies.
Telehealth technologies are evolving rapidly and provide excellent diagnostic quality. For many applications, telehealth is as good as or better than a face-to-face consultation.
Telehealth technologies also include peripheral devices, such as stethoscopes and exam cameras.
The number and quality of peripheral devices that can be integrated with telehealth technologies is also increasing. As a result, we are able to provide diagnostic capabilities that would otherwise be unavailable.
The use of ultrasound in telehealth is proving to be invaluable. The ultrasound equipment is connected to a video conferencing unit, allowing the specialist to consult with care providers and the patient from a distance.
Privacy and security are of paramount importance for the delivery of telehealth services.
Just as telehealth brings people together, telehealth programs are successful when multiple stakeholders from both clinical and technical backgrounds come together to develop policy and procedural change, and then help to integrate those changes into sustained practice.
The most important thing to put in place is the business process behind the program. So where the chart will live, how recording will happen, who will do the clerical piece, making sure that the information is there for the physician or the care provider.
In order for telehealth to be successful, aside from business processes, important details need to be considered. These details need to be addressed whether one is developing a new telehealth program or in maintaining a successful one.
Details like room specifications, including lighting, paint, soundproofing, furniture, patient registration, booking, informed consent, confidentiality, navigating the patient through the telehealth facility.
My job in telehealth is basically to greet the patients and bring them into the room. I then make sure that the equipment is turned on and show them how to use the camera. I also explain to them what the telehealth session is like and what to expect from it. When the doctor connects in, I then leave the room and let the patient have the telehealth session with the doctor.
Prior to the telehealth option, I would have had to travel for at least a day and possibly even an overnight, depending on what time of the day I might be able to see my physician.
You walk in the front door of the hospital and have your x-ray taken. By the time you get upstairs, the x-ray is waiting in his office in Victoria.
Basically, you just go in and flick a power switch and you've got a little remote, much like a TV remote. And in order to connect up with the various sites, you choose from a menu.
Physicians are starting to use it more and more as they become more comfortable with it.
It's very easy to do. They dial in, and assuming somebody's on the receiving end of things, we can see them and they can see us, and you can carry out a conversation just as we are here.
If there was one thing I'd say to people reluctant to try telehealth, I'd probably tell them about some of the client responses I've had.
I was astonished at the clarity of the communication and the picture.
It saves you money, it saves you time, and the anxiety, the stress level is much lower.
And the whole experience was just very gratifying, and I come home and I felt like I just walked down to the corner and back.
They let us know that it's just a wonderful opportunity for them to get the service they need without the travel, the cost, the time, and the fatigue that goes along with traveling if you're not well.
Telehome monitoring is a promising development in telehealth for chronic disease management, providing healthcare monitoring for patients in their own homes.
So telehome care is using information technology and communications to manage patients' healthcare in their homes. The benefits to patients are that it's a real sense of security. The nurse or the physician can contact the patient if need be.
Please step on the scale.
If the patient does their vital signs and they're within their parameters, they can just go about their daily lives. They don't have to come in for any testing.
Place the blood pressure cuff on your right arm.
They don't have to come into a clinic to get further education. For the families, it's a real security blanket. Also, it's a real time saver. Now they can just spend time with their loved ones, and they don't have to be bringing them back and forth.
Press the green Start BP key.
Some of the patients that we've looked at putting the monitor on have had to travel 30 miles every couple of days to do testing. Now the family can just come over, spend time with their loved one, and really look after them as a human being and not just be looking after their medical condition.
Because First Nations populations have a high prevalence of diabetes, VIHA is working in partnership with those communities to develop chronic disease management solutions that can be enabled through telehealth technologies.
We're always looking for opportunities to reduce the isolation and overcome service barriers that Aboriginal people experience when they access health services.
By implementing telehealth on Vancouver Island, we've provided our remote and isolated communities with increased educational opportunities for remote healthcare providers. We can now provide more education to more staff more often in a much more convenient way.
Telehealth offers a number of exciting opportunities. I believe it reduces barriers to services, it enhances services, and it increases the education opportunities for people living in remote and isolated Aboriginal communities.
Staff can receive their education on-site with their colleagues at a time that works for them. They don't have to travel sort of all day for a 3-hour educational session. Instead, it can be offered early morning, often without interrupting client care and the flow of patient care.
Telepathology can help with the delivery of rounds and education by virtue of an expert in a tertiary care center like ours here in Victoria making those rounds instantly and widely available to many different communities.
So we know telehealth can work. We know it works really, really well for some services, and now we need the public to really start to become aware of what it can offer them, the benefits, and start asking their physicians, asking different care providers if they can have their service via telehealth versus traveling.
In 5 years' time, telehealth technologies will advance considerably. We envision being able to support patients and their families in their own communities, in their own homes, in more fulsome and innovative ways.
When I do my clinics, I wander in and see a patient face-to-face, and then the next appointment I go to the telehealth room, which is right in the clinic, and I see a telehealth patient, and then I go back and see another patient.
At the end of the day, I think if we take full advantage of it, I think we can cover the island in a better, thorough way.
virtually gives us instant access to those slides and an instant diagnosis.
You know, half my follow-up clinics are now telehealth.
The delivery of care is much more uniform and at a higher level.
I think that it's really been a kind of a win-win situation for everybody.
Telehealth on Vancouver Island.